Welcome in. My name is Mark Bergin, joined by WRAL's Brian Shrader. And Brian, we're talking about measles in North Carolina tonight.
Yes, it's something that is not unexpected. We're dealing with these measles reports and these potential measles exposures because since the fall, we've been tracking all of these cases in upstate South Carolina. Of course, they've had a cluster of measles cases there around the Greenville-Spartanburg area. Hundreds of cases reported over the past few months. And then in December, I believe, is the first time in North Carolina that we got that report of a measles exposure in Buncombe County with some measles cases, and it's just been spreading since then.
Yeah, 18 cases in the state. And so if you have questions for us, I'll be monitoring your comments here live on YouTube. So if you have questions, feel free to leave them in the chat. If you're watching this after we're live, we'll try to answer your questions as well. Neither of us are doctors, but we can do our best to make sure that people are staying safe. But Brian, I think first we should probably just go to this map showing where both the cases and exposures are here in the state.
So there you go. And you know, those first cases in the western part of North Carolina, that tracks with that outbreak in the upstate part of South Carolina. And then, it's been spreading toward the east here, and we had those cases right around the triangle, or those exposures reported around the triangle. We got the notifications about it this week. It looks like the exposures, though, happened last week. That's when the people who were infected with measles were in public places. And in Wake County, in Durham County, also in Johnston County, the person who went to the emergency room down there. And that kind of underscores what they tell you when we get these potential measles exposure notices from the county health departments. They say monitor your symptoms. And if you develop the symptoms, call before you go to the doctor, call before you go to the hospital, because it really underscores just how contagious measles is.
Yeah, not seeing any questions so far in the chat. But again, if you have questions for either of us about measles here in North Carolina, please let us know. But Brian, I think it's interesting that you see Wake, Durham, Orange County are considered exposures versus the counties that you see in red on your screen are confirmed cases. And so that has to do with where people reside. So you might have heard the reports earlier that we had this week about in Raleigh, there was someone who went to 5 different locations on February the 5th. So that's why you see exposures in Wake County versus if you see Johnston County just next to it in red, we've confirmed with the county, we've confirmed with UNC Health that there was a confirmed case of a resident there. And so we'll have another map here that we can share as well from the state that I'm going to go to as well, which shows where the cases are. And so specifically what this is showing is where people reside. So you see Nash County highlighted right now. We expect to see Johnston County tomorrow when this map updates from the state again. That'll happen around noon on Friday.
And how often do they update the state map?
Good question, Brian. So it's Fridays and Tuesdays right around that noon hour. So we are expecting an update. I would imagine that we'll see more cases by county when you look here at this state map. But again, what the state map is showing is where the people are residing with the 18 cases throughout the state. Because, for example, the Raleigh exposure, and let's go back to that initial map, the Raleigh exposure was someone visiting Raleigh from South Carolina.
Right. And I think based on what I saw from the Durham alert yesterday, they did not say where that person lives, but they did point out it was not a Durham resident. And I think that something else that, as we've heard about measles, as it's become more of a story nationally over the past year or so, how much do you need to worry about it? And I talked to Dr. Cameron Wolf from Duke Health earlier this week asking those questions. If you have the vaccine, you pretty much don't have to worry about it. So that's good news.
Yeah, the efficacy is very, very high. There's no cure for the measles, but the vaccine really, really works. And that's one thing, too. They're recommending for children, first dose between 12 and 15 months, the second dose between 4 and 6 years old. They also recommend for adults born after 1957, they should get vaccinated as well, Brian.
He was explaining that if you were born before 1957, measles was so widespread that you probably got measles. So you don't need the vaccination because you were already exposed to it before 1957. And then just the nature of those vaccinations that came along after 1957, you might need to get a booster shot, basically. Between 1957, was it 67, I think, into the 60s. Talk to your doctor, basically. But then after that, if you got the shot, you're in good shape.
I have a question for you. Did the doctor you spoke with, Brian, say anything about mask usage? We have a comment from a viewer asking, should he or she wear a mask at all?
He did not address that specifically. That's a really good question, though, because it is an airborne, that's the mode of transmission,
yes.
Is airborne. And he was saying that if you are not vaccinated, this is not like COVID, where, we could be in the same room and just, if the virus got to you, maybe you'd get it. If you are exposed to measles and you don't have the vaccine, there is a 90% chance that you will get measles, that you will develop measles, and that's why it's so serious.
Really interesting there, but good point about how it spread, Brian. Mm-hmm. Through the air, an infected person will cough or sneeze, mm-hmm. and so that's how measles can spread.
Yeah, something else that Dr. Wolf was talking about. We're talking about different groups that need to be concerned about it that maybe you don't think of immediately. Very young children. So you said they recommend the first shot between 12 and 15 months, second shot after that. Talk to your pediatrician if you have a newborn child or a child younger than 1, because there are some allowances that they have given the vaccine to children younger than 1 if they're traveling and so forth. That's a conversation you need to have with your pediatrician. If you have some immune system suppression, maybe you've had chemotherapy or some other condition that has suppressed your immune system, that's another chat you need to have with a doctor, because you may have gotten the shot, but it may not be as effective because of your immune condition. And he also points out that if you are expecting to have immune system problems, maybe you're about to undergo treatment or something like that, go ahead and get that vaccination.
Oh, really good information there, Brian. I also want to point out, too, among the 18 confirmed cases in the state, 16 are among children. So I'm talking about people ages 17 and younger. So only 2 cases of the state's 18 among adults, at least at the time of this recording right now. We're recording this on Thursday night here, so obviously that could change. Again, we're going to get that update from the state right around noon on Friday.
Something else that I asked Dr. Wolf specifically, what is the real risk here? Like if you have a child who's unvaccinated or you're an adult who's unvaccinated and you get measles, what's the real risk here? And he said that yes, there's a very small chance, 1 in 1,000, that you'll die. But he also points out that we do far more in medicine for conditions where the risk is much smaller than that. So, 1 in 1,000, you say, well, those are pretty good odds that I'm going to be all right. But 1 in 1,000 is a lot. And I know I've seen some pushback online. Well, people used to get measles all the time. Everybody had measles and I'm fine. The people who died are not here to tell their story. And when you think about the death rates, even though statistically it looks small, you're talking about many, many people who died of measles. And Dr. Wolf says that if you're a child who gets measles, there's a 20% chance you're going to end up in the hospital. 20% of children infected with measles end up in the hospital because this is a miserable disease to have. High fever, diarrhea, terrible diarrhea apparently is a problem. He says that these are not children who end up in the hospital because they need to be isolated. It's because they really, truly get sick. And he said that there's a chance that they'll have a loss of hearing from the damage that this virus does. There's also a chance that they could suffer brain damage because of the swelling that can happen in the brain in these high febrile sorts of diseases. So the risks are, even though you see statistically small chance of dying, still you run a really significant risk of running into trouble if you get measles.
A lot of terrific insight there from Brian. Again, it's the MMR vaccine. That's measles, mumps, and rubella. And then another thing I want to point out too, and we've got a viewer named Daisy May checking in, and she's wondering about, well, if a child has measles and brings it into the school and exposes other students and teachers, what happens? What I would tell Daisy May is you can look on WRAL.com, and we actually have what those vaccination rates are by county. So that's a resource that we have available on WRAL.com.
By school.
Yes.
The state has it broken down so that for K through 5, you can find in your child's school, in their grade level, the estimate of how many students are vaccinated.
That, and then I would just encourage people to check in with their districts, check in with their child's teacher, with the principal, just to make sure that we're all staying safe. That's really the big purpose of all of this, is to make sure that everyone can stay safe and stay healthy throughout this whole process, as this just continues to spread. Again, 18 cases we've seen here in the state of North Carolina dating back to December.
And we have a lot of resources at WRAL.com to kind of give you a primer on what's happening here. But I think one of the big messages from Dr. Wolf earlier this week is that if you have any questions about this is a conversation you need to have with your doctor.
What I want to ask you too, Brian, is if people want to either watch that interview or get more information about that, where can they find that of your conversation with Dr.
I
Wolf?
talked to him Tuesday night.
Losing track of the days.
Yeah, I know. It's all blended together. But it's in our story that we have been running, that kind of our running story all week on measles.
What I would encourage people to do as well is on WRAL.com, if you search for the word measles, we've got a Q&A of pretty much everything you need to know about all the resources that we have available to people as well. So I also want to thank, people who've asked questions. Yeah. Another question we got too is whether you need a booster. I know the answer is no, at least in our QA from the doctors we've spoke with. Again, I would encourage anyone watching this, we have it linked in the YouTube description as well. Go in and check out that Q&A that we put together for just pretty much everything you need to know about measles in North Carolina.
If you are unsure about your vaccination status, this is another thing. Maybe you're not completely sure you got the vaccine when you were a child. Dr. Wolf says there is no danger in getting that booster shot.
Okay.
So, talk with your doctor. Your county health department is also an excellent resource that can answer these things. And if you need a booster and you already did get the shot, it turns out you'll be fine.
And in Wake County, I've got that number as well. If you did need to get a shot, the number is 919-431-4000. Again, that's 919-431-4000. If you have any questions about this, if you need to get a shot as well, it's another resource that we have for people.
The bottom line I got from Dr. Wolf is that you don't want to get measles. I mean, not only is there the risk of dying, but it is a really miserable disease to have. And it spreads so quickly, so effectively, that, getting that vaccine that has now been around for decades is really the best way to protect yourself and the people around you. This is also one of those things where you have to think about the person who does not have a strong immune system, the child who is not old enough to get vaccinated, and whatever you can do to stop the spread of a disease like this, seems like you ought to do it.
Brian, is there anything that I'm missing, I haven't asked you about? I do think that we've hit on a lot of really, really good things. Again, I would encourage anyone watching this after the fact. We've got a few dozen people here watching. But if you come across this video after the fact, leave a question in the comments. We'll go through them, do our best to answer them. But anything I'm missing before we wrap here?
No, I would just, the takeaway was, if you have a question, this is a conversation you need to have with your doctor. In this day and age, a lot of people are hesitant about vaccinations for whatever reason. This is a conversation to have with medical professionals, not stuff necessarily you see on social media, but a doctor can guide you in the right direction, help you make that decision, weigh whatever risk there might be in your particular case to make the best choice for you and your family.
Well said. He is WRAL's Brian Shrader. I'm Mark Bergin. Thank you so much for watching here on the WRAL YouTube page. If you haven't already, make sure you hit that like and subscribe button. Again, thank you so much for watching, and have a great night.